Hello Curro family, and welcome to another crucial update on the COVID-19 pandemic. Today I'm discussing a topic that is really important for you and for your children. I've been getting a lot of questions on the blood clotting risk and is this a new disease, is it a new bacteria? They found evidence of blood clots in patients where they did autopsies in different countries overseas. And are we missing the diagnosis of COVID? We always thought it was a lung disease, and now we're seeing patients with blood clots in their lungs, and we see stroke risk victims, we see heart attack risk victims. We even see little blood clots on the skin, on the toes, on the fingertips. Now, all of this ties in with COVID, and I'm going to show you today that there's proof of this. It's the virus that still enters at the ACE2 receptor. Remember, the ACE2 receptor is like a lock. And the virus has got a key on its outside. That's those little spikes on the outside. And that key can open the lock. Wherever you have a cell in your body that has got that lock, the virus can open it. Now, two very important areas. As we said before, the lung cells, the type 2 pneumocytes, they're responsible to keep your lungs open so that you can breathe and those bubbles are nice and open to get oxygen in. But then, secondly, there's also endothelial cells, which are the lining of the blood vessels that I've discussed in the previous video. So all your blood vessels, your capillaries, they've all got a lining of cells called endothelium cells, and those cells have also got the ACE2 receptor, or the lock. And the virus, once it's got through the lungs, if the disease is not controlled in the first 5 to 7 days, like it happens in 85% of people, this will not be relevant because they will not get blood clot risk because the virus will not progress so far into their blood vessels that it can affect so many of the little blood vessels and cause inflammation and swelling of the blood vessels. So what happens in patients that get severely ill and not get better after a week? The virus then also enters the endothelial cells. It breaks the endothelial cells, disrupts them, and as discussed in the previous video, it releases a substance called von Willebrand's factor. And von Willebrand's factor causes a whole cascade of blood clotting. Now let's get to this very interesting study. They did a study, you can see it in the New England Journal of Medicine, a very reputable publication. Because I'm not going to go over this long topic there, it's a little bit difficult to explain to everyone what all that means. The important thing that you've got to know is that what this means is that they have seen that in the lung there was inflammation of the lining of the cells that causes blood thrombosis or blood clotting and new blood vessels to try and form and to try and give blood flow around the lung. What they've done in this study, they took 7 lungs obtained through autopsy of patients that died from COVID-19, 7 lungs obtained from autopsy from patients that died from ARDS or respiratory distress syndrome in influenza A H1N1. That is swine flu as we know it. And then they also took 10 age-matched uninfected controlled lungs of people that died. The very, very interesting thing, you can read through the study, I'll put the description of the study in the link down below, but if you read through the study, you'll get to the result page. You can see the lungs there, you can see some imaging that they saw under the microscope. Important, you'll see they talk about the ACE2 receptor, but this is what I want to get to. If you look at this view, and I'm going to give it to you slightly larger, you'll see that what we've got there, the white part is the alveoli, it's the pockets of air where you breathe into in your lungs. And these are the walls of the alveoli, and the walls are lined with blood vessels and different type of tissues. Now, a blood vessel, if you cut a blood vessel on a cross section, you will see a round circle like that, and it will be fairly clear. The problem with this that they saw in the COVID patients, you had blood clots filling up those blood vessels. This is a blood vessel that was cut in its length, and you can see it's full of blood clot. So not only do you get cells and fluid that fill the lung, like we explained in the early part of the COVID pandemic, you also now get blockage of the small little blood vessels, which further reduces oxygen to flow to the rest of your body. So the result is that you see patients that have got very low oxygen levels and their lungs are not that bad yet. So we wait on them and we don't give them oxygen early because we think that the lung's not that bad yet. But it's really important to know that if you check the oxygen levels and you give high oxygen flow treatment, you will get a much better result, and that's what they're doing at the moment in ICUs and in hospitals. The next thing they also did, they took these amazing pictures with an electron microscope of the tissue of the lung. So you can see the hollow areas where the alveoli are, and then the structure all around it, full of tiny, tiny little blood vessels. And when they looked at the cells inside the cells, obviously this is very, very tiny, they saw virus particles inside these endothelial cells, which proves that the virus enters the endothelial cell, damages it, and when it damages it, it causes blood clots that happen inside little blood vessels, reduce blood flow, reduce oxygen. Okay, so just to recap, the virus with its RNA, it has these S spike proteins on the side. The S protein links up to the ACE2 receptor. When it binds to the receptor, you can see it's activated. Now the door opens and the virus can go inside into the cell to get replicated, to get produced so that it can multiply. And that's eventually will then damage the cell, and the cell will break. And as those cells break, you get this big problem of blood clotting that increases all across the body. Now the very interesting question. Everyone has been asking me, so should we take Aspirin? Why can't we just take Aspirin to thin our blood and we're not going to get this problem if we get severe disease? And remember, I want to emphasize 85% of people will never get to this stage because they're not going to get that long progressed viral infection. So this is more the patients that have to get admitted in hospital or get serious disease. They are the ones that are at risk for the blood clots. Back to the question, should you use a Aspirin? It's important to note that there's a couple of clinical trials going at the moment to try and prove if taking Aspirin will help. We haven't got results yet, so it's very difficult to say, and we shouldn't just jump to the conclusion that everyone should take Aspirin. And remember, if you look at these trials, they are all done with aspirin 100 milligram. There is another discussion that was done in the University of Miami and recommendations that they did for COVID-19 treatment, but this is for hospital admitted patients, and they don't give them Aspirin, they give them low molecular weight heparin. So heparin is a substance that they can use to prevent the blood clotting risk. They do that after they've had tests done, especially the D-dimer that we spoke about in our previous video as well on blood clotting. Important to know that aspirin was spoken about, but again, they don't know if the aspirin will actually make a difference as a precaution, and it's not recommended to take. We need to remember that if you go to your local pharmacy and get 500 milligram aspirin extra strong, or get 300 milligram aspirin, the normal Aspirin, it is going to be way too much, and you stand a very high risk of getting side effects or complications from taking the Aspirin. So I would not recommend doing that. You can definitely get bleeding risk, ulcer bleeding risk. You can get nosebleeds, various kinds of bleeding risk because of the high dose of aspirin that you're taking and you're not supposed to take. So anyone that has got previous risk of ulcers or heartburn or stomach problems should not do that. The question is, should you take a low dose, the 100 milligram that they are using in the trials at the moment? I would really not recommend that at this stage. You can maybe speak to your physician if you have other risk factors, but definitely don't just start and take Aspirin. What is important though is that when you do get sick and you don't get better after a week, to get your blood clotting profile checked. Now, let's get to the children. It's very important to know that children has a risk of developing a condition called REYE'S syndrome. Now, REYE'S syndrome is a condition that develops when a child, and if I say child, I talk about children under the age of 18, especially under the age of 12. Risk factors in children. The following factors usually, when they occur together, may increase your child's risk to develop REYE'S syndrome. Using aspirin to treat a viral infection such as flu, chickenpox, or other upper respiratory infection. So that is important. We should not give children aspirin. We should absolutely avoid doing that. and treat them with normal paracetamol or Panado. That would definitely be the better thing to do. I hope this has given you some insight on the blood clot risk that only develops in the latter stages of the disease should you not get well, and also to remember to not give Aspirin to children. Lastly, I want to look at vitamin D. This was published in the Lancet. One mostly overlooked factor that could influence the outcome of COVID-19 is the relative vitamin D status of populations. Now, you can read further in this article. I'll put the link down in the description. You will see that the role of vitamin D in the response in COVID-19 could be twofold. So because we're not getting enough sun at the moment, because we have a lockdown, if you can get sun for 20 to 30 minutes a day, it's a good thing. But if you can't, you need to take some vitamin D. Vitamin D comes in two main dosages. You get a high dosage of 50,000 international units. That's not recommended in this case. And you get another dosage of 5,000 international units that you can get at your local pharmacy. And that is sufficient to take 5 times a week, maybe not even 7 times a week, to get your vitamin D levels up. That brings us to the end of this video, and with the schools starting to open and people starting to get out into the open a little bit more, important to follow the rules, wash your hands, wear a cloth face mask so that other people don't get infection when you sneeze or when you cough. Make sure you get enough rest. That's really important to get your melatonin levels up. Make sure you get a little bit of sun if it's not raining outside. Vitamin C is good. Zinc has been proven to definitely make a difference as an antiviral replication agent. And important, do not give children aspirin. I'm Dr. Schalk from Dr. Luke on Call. It's because of a lack of knowledge that our people perish. We will overcome this. We need to keep on doing the right thing, stay safe, and stay healthy.